Welcome.
Hello and welcome to the Cybersecurity Mastermind series organized by Cyber Houston. We are live and excited to have you join us today. In this series, we highlight our cybersecurity rock stars, masterminds, and bring valuable information to you, especially during this unprecedented time. I am Umesh, Verma, CEO of Blue Lance and the founder of Cyber Houston. We would like to thank our sponsors, Hewlett Packard Enterprise, Blue Lance, Reneka Digital, and the University of Houston Downtown for underwriting the Cybersecurity Mastermind series. For our audience, we are happy to answer questions along the way. So if you have a question or comment that pops up anytime during the session, please enter it in the comment section on Facebook or YouTube under the live video, and we will try and answer them. Today's topic is protecting patient medical records during COVID-19 and every day with an eye on the future. Our expert is Dr. Phil Beckett, CEO of HASA and a founding member of the Greater Houston Cybersecurity Council. Phil loves fishing, is an avid sailor, and it wouldn't have surprised me one bit if he had wanted to do today's live broadcast from his boat. Welcome, Phil. Great to have you on.
Thanks, Umesh. It's a pleasure to be here and do this with you. And yeah, it would be nice to do it from that boat.
Yeah, it's pretty day out there today too, right? In the Gulf.
It's gorgeous.
So Phil, before we get started, how's your log cabin coming along?
Thanks, Umesh. My little log cabin out there in the middle of nowhere in Texas. It's pretty much done. Although you know it's never quite finished. If I can, maybe I can share a quick photo with you all on.
Let's do that. Yeah, the last time we met for lunch, we were talking about this, and you were telling me about the detailed planning that you put into it. It was amazing.
But this was a real education for me in project management. You know, I thought I knew project management, but this thing's 250 miles away from my home, and I built it all myself and tried to do it as a kit. So I would measure everything up and make it in pieces parts and then load it up in a truck. And I tried to do it all in, as fewer visits as possible. So how do you get all of this into one pickup truck and a small trailer, then get it up there and build it and have it fit? You can imagine plenty of things went wrong, but it's a great place to be.
You're the only guy I know that would take months to plan how to pack and cut all the supplies and pack your pickup truck and make sure that you optimize the number of loads and the number of trips you made back and forth. And I think your whole point was you built it all out of one trip that you did at your pickup trip.
That's right. That's right. And then related to today's topic, I guess the safest computer is the one that's disconnected from the internet, and that place is certainly disconnected.
So that's when you go hide out and just be with yourself, right? And you built the whole log cabin just by yourself. You had what, 12-foot and 14-foot pieces of logs that you were building hoists for and building it all and lifting it all yourself?
It's true. I had to make the crane myself as well.
Wow. So tell us that, so that's what you do in your free time. You fish, you sail, you build your log cabin, you break away, you disconnect from the internet. And yet, as CEO of HASA, tell us what HASA does.
Sure. So HASA, we're a not-for-profit. We're small. We're a health information exchange here in Texas. And what we do is to share medical records securely with physicians, hospitals, health plans, but all appropriately, securely, and following privacy practices. The real goal of this is around our mission, which is the quadruple aims, which was really formed to improve patient health outcomes or community outcomes in healthcare, reduce the cost of individual healthcare, and improve the experience for both patients and physicians. So really, if I turn up to the emergency department, and that's happening today, the physician can then look up my medical records and quickly see, my history, if I've got a heart condition, if I've got other comorbidities that they need to be aware of. So we really we're just the network that does that. Obviously, we don't see patients. And I think in today's, where we are today, Umesh, I think in the context of our conversation, I think it's good just to, a little bit from the business side of healthcare and where that is in this crisis today. You've seen these pictures of so many people with, and especially like in New York, in the hospitals, but you've seen a huge drop in work from other things. People are not going to the hospital for even acute things like strokes or heart attacks, but all the preventive stuff. So physicians and their practices are really struggling with their bottom line. So as HASA, we're really trying to support their work, especially through telemedicine, and so that more people can visit their physician through telemedicine processes. And I think, again, back to us as from the cyber world, that really provides a lot of opportunities today, but also going forward as you think about remote patient monitoring, the Internet of Things, the security, and we'll come back to these topics, but the security of communicating over video chat with your physician provides an opportunity for cybersecurity and also for hackers. So looking forward to discussing these things more with you today.
Yeah, and you were talking about putting off all the non-essential surgeries and doctor's visits. I mean, we've all seen that. In fact, in my own personal case, I've been putting off, I have a tooth issue, which I've been putting off. And, I don't want to go to the doctor's office till I know that it's somewhat safe or I absolutely have to go. So I think that's made a huge change. So healthcare data, by the very nature of healthcare data, it contains very private and personal information on patients. And it is also in high demand on the dark web, simply because if you know someone's malady or problem, you can write them and phish them and talk right to their issue and kind of maybe convince them to click on a link that can get them to a nefarious website and install malware on their computers. But, there is a high demand for patient records on the dark web. What's the current going rate and what do you see as far as trends and stuff?
Yeah, no, you're right, and also around identity theft. You're losing your credit card is quickly canceled by the bank. It's not worth a lot on the dark web. Your healthcare information's value forever. And if I'm, you spoofing somebody's identity with their medical record, you can get a lot of maybe procedures or these things for free under somebody else's coverage. And yet the Trustware report just from this first quarter this year says they're worth about $250 each. So for a single physician practice, say you see 2,000 physicians a year, you obviously got some history there, but that's worth $500,000. If you're a 10-doc practice, that's maybe 15 million. If you're a big integrated delivery network, that record set that you're storing may be worth $1 billion. On the dark web. So huge value to hackers to access that. And I think the other thing that we're seeing in the last quarter of 2019 saw a increase in ransomware attacks on healthcare up by about 350%. And that is now with ransomware as a service, you can be anybody and just get a ransomware. You can use services without being technically savvy to go attack targets, and healthcare targets have become a big part of that. So we've seen a huge increase too.
So that's a very interesting comment that you made, that the threat actually scales and the cost of the breach scales with the size of doctor's office or clinic that you are. So at HASA, you store a lot of healthcare data. You take data from all of your providers and clinics. Maybe you can give us a little bit of a flavor on what kind of clinics and what kind of data you store, and then what do you do to protect it?
Yeah, sure. So we store all kinds of clinical records. So that's, patients' demographics, their medical history. Really, we have the longitudinal record of problems, medications, allergies, procedures, and that's, in terms of sharing between a physician's office and a hospital, that's critical as the patient moves around for care. But it's also critical that it isn't shared inappropriately or accessed. So I think, we look at it from two perspectives. One is the data that we're storing and when it's in transit, so that it's always encrypted, it's encrypted at rest, it's encrypted in storage, and we're monitoring that process. We're going actually through the high trust certification. We're towards the end of that process now, which is a lot of controls around the security of data. So that is the easiest side of this to control. The other side is getting access to that data. So we try where we can to integrate into a hospital or a physician's office identity management system, so they don't have a new log on to access HASA data. It goes straight integrated into the electronic health record. They never have to come out of their workflow. It's easier on the workflow. It's easier on the credentials. It's easier on the security. Plus, they can't access any patient records that are not theirs. The risk becomes, as we've talked about with Cyber Houston, is if you've got somebody who has direct access to log into your system. So those are the challenges, the special challenges for us. How do you monitor every account that has direct access, including our own staff, and make sure that no data, is used nefariously?
So we have actually a comment come in off of our YouTube live discussion, and it's from Deepak Chowdhury. He's also a founding member of our Cyber Houston, Greater Houston Cybersecurity Council, and I think his comment is that he thinks the average cost of a complete health record for one patient is about $300. So that's a pretty tidy sum, and when you lose in thousands of records, I guess. It's not. And then there are all kinds of other fines and breach notification issues, etc.
Oh, sure. It's no. Thanks, Deepak. Yeah, I was $50 off there, and but it's you're right. In terms of business reputation, it's also a huge impact. It can put you out of business. If you lose more than 500 records, that needs to go in the newspaper and be reported. So it's a huge public relations impact too, as well as a financial one.
So Phil, you were talking about the different size of organizations and scale of different organizations that you connect and you supply healthcare, electronic health records, and you move the data back and forth so that people the provider has one single pane listing out all the different places and tests, places that a person may have visited, different doctors that they've visited, as well as all the tests and all that they have undergone. So when you're connecting all these very different size of organizations, they all have different levels of sophistication and cybersecurity maturity. So what kind of challenges does that pose?
Yeah, we really try, again, to integrate with their electronic health record system, which is typically today, hosted by a sophisticated organization, a big platform like Athena Health or eClinicalWorks or Epic or one of these, where they're managing the security, so that we're then doing a server-to-server connection. So we're not having to manage individual control within a physician's office. There's no server under in a closet there that we're connecting to. But definitely challenges on that front. And I think the other things to be aware of that we do is you only have access to patients that you see. So if there's a patient you've never seen in your electronic health record, there's no way to access that patient's record through HASA. You can only see patients you have a relationship with. And then the second is patients always have the option to opt out of this. They're provided with information at the time they're signing forms when they see their physician. Do you want to share your data with across through the health information exchange, and the option there to opt out. The way we keep that is we store that patient's latest expression with a timestamp so that they can update it at any time, at any place, and say, I'm in, I'm out. And again, trying to empower, how do we empower consumers whose medical record it is to have control over that and who sees it?
So that brings us to patient authorization, I guess, and opting in and opting out. And I think you said that as a patient, if I go to, let's say, a smaller clinic, my doctor's office, and then I can opt in or opt out there. And then if I go to I have a major procedure that I need to go under or get a test or whatever, and I go to a bigger hospital system or an emergency room to handle that, I can opt in, opt out there. So which one rules, or is it just the latest one?
Yeah, it's just the latest one, and it's binary. At the moment, it's all in, all out. So kind of, back to our title, or part of our title here, Eye on the Future, I'm really, with others, of course, looking at how can you move that authorization process into the patient's hands so that I manage both my identity, ideally, and my authorizations, so that I can change that at any time across all my providers. There are many technical ways to do that. Part of it's the behavioral. How do you engage us as consumers, me as a patient, to take the time to download an app or whatever that is, and then take the time to do that. But I think, we all do it with our bank today. We manage our own bank accounts. We get notifications when transactions happen. We authorize transactions, even big ones. You can authorize scary transactions out of your bank account, just yourself. That's not the way really it is with healthcare. You're in this position of going for care, and sort of in that decision point, hey, I want to be taken care of, so I'm going to sign up, if that's part of the requirement. I think we're going to see a shift in the future to where consumers have more control and are expected to do more around the management of their authorization. And maybe I just adding one more comment to that, and we come back. But like, some data is especially sensitive, like substance use disorder or behavioral health issues that don't need to be shared with everybody. We have no way in our current system really to manage that kind of granular authorization. It says, I want to share this record, with Dr. Verma, but no one else. And really, there's no time in the clinical workflow to do that. Patients would have to be the ones managing it.
So do you see, when I look at it, the driver's license is compromised, the social security number is compromised, your passport number is already compromised. Do you see healthcare moving towards a unique patient identifier? And then also, do you see the risk with, how do you see people wanting to rate the health rate, come out with health ratings and health scores like you have in finance and banking, like credit scores? And how does all that work? That's scary stuff.
No, I know it's been interesting because Congress has been arguing back and forth about this universal patient identifier. I think if it's something like we had with the social security number, where it's just one ID, that's like single factor authentication. It's going to fail. It's not useful, and it'll just get abused. And I, in my own, and I've, again, discussing with others how this might work. And I've even pushed, I've been to DC and talked to staffers there about how this might work, but moving more to a two-factor identity method. So you've got all your public information, like your name and address and your social security number, that everybody knows. But then there's other things that only you know, again, like your bank account. If you want it, you've got to put in a PIN, or you get a text message with the code. I envision a way where patients are managing, or consumers again are managing their own identity with two factors, where I go to the clinic, they get my name and address, so they can get that off my driver's license by swiping it. But then there's a second factor, or that's my thumbprint, or that's text message that I get with a code that is then used to verify me. And then I also, just like with my bank, if someone else tries to use my identity, I get the notification on my cell phone that says, hey, somebody's trying to, use your ID at this clinic. Is this you? And you say, no. So that solves two problems. I mean, not to be oversimplistic, but it solves the problem of patient identity. We struggle with patient matching across systems because there's typos and addresses and names, and we use different names in different places. And that starts to solve that problem because we've got verification with the second factor. And it also helps to solve the problem of identity theft and spoofing so that somebody can't use your medical record without your two-factor identity. So I'm interested to see where that goes, and I'm interested in exploring with others how we might do that in Texas and across the nation.
I know you're always pushing the curve. I'm just thinking that, I don't know how many clients you have connected, but it's at that size and scale. I think there are lots of challenges in connecting, and the cyber stance of a provider that's small and large, and it's just going to be interesting. It'll be challenging. There'll be a lot of opportunity. Now you'll have 300 million people that you want to have a unique healthcare identifier with, and maybe even more because it's even international and global. And
right.
So how does that even begin to, how do you begin to grapple with that? And what's the change in cyber stance going to look like for both providers and the patients?
Yeah, and I think it has to be, more distributed. Again, putting 300 million people in one big database of identities is not smart, both from a storage, and it's a honeypot of data. So we've got to come up with solutions that are more distributed, and maybe even go to the other extreme. Say I manage my own identity myself. I can do that with my credit union or a bank or some provider that I trust to manage my identity, and I have access to that. I know everyone I have access to the audit logs. I know everyone who does a call to that and says, is this Phil Beckett? And go really distributed. That makes it much harder then for anyone to access those identities. And I think it's much safer.
So let's try and figure out if there are any other questions coming in. So there was a question coming in that says, did this COVID-19 pandemic have any effect on rules around sharing of data, and were they relaxed?
So to some, in any disaster, so the short answer is yes. So in any disaster, because that's the way we do things, like if there's a hurricane in Houston and people go to Dallas or they go to Austin, San Antonio, and the physician, they go to shelters there. Physicians from around the country have come to help, and access to records, as it is it tends to be freed up. But that's partly because that's the solution that we have today. I think, again, we need to be, there is a tool, Pulse, that's been used just in California for the wildfires, was there, but that's really a way to access medical records across, and it does have an authentication process. Physicians have to sign up first and be credentialed with that. So that's one layer, but it doesn't really restrict which patients you have access to. You still have access to all patients. I'd like to again think about this, assuming you don't lose your phone, or again, there's issues we have to get around, but in terms of that identity management and authentication by the patient, if that's in the control of the patient, and I can say, yeah, this is me, Phil Beckett, and here's my medical history, and I can give that to anyone I want to take, who take care of me. I think, lessons learned from this is we need to have tools in place ready for any disaster, whether it's COVID, whether it's the next pandemic, whether it's the next hurricane, the next earthquake, to enable access to records that's secure and safe.
So, many people have moved to virtual meetings and to Zoom meetings, and you hear so much about the Zoom security flaws. What's going on with telehealth? I also see that there are many doctors' offices that are using products like Zoom to provide telehealth, or do they actually? And then, are there other applications that are specifically within the healthcare area that provide a lot more security and privacy?
Yes, to both of those. I mean, you do what you do at the time. If all of a sudden my patients are not coming, or my office got closed because of the government says so. So now I still need to see my patients. So I'll use whatever tools available to get my hands on, but then it's going to move. There are specific tools for telehealth that are sophisticated. As HASA, we've been trying to support those secure ones as well by doing the data integration so that you can move your medical records between what you document through a telehealth platform and back into your own electronic medical records so you don't lose that. The health plans are paying now for more of these telehealth, so that encourages the use of that. But I think we'll see. We'll see more telehealth coming, and physicians will migrate to the platforms that are secure, going forward.
So we have a question coming in off of Facebook, Phil. It says, how do you see us managing healthcare data access, privacy, and security in the future?
Yeah, I mean, and this is probably, Phil's editorial. Our medical records are our own. We're the patient. We should have access to that. And it's interesting now. The Energy and Commerce Committee in Congress is working on a bill. They published a draft in December of last year, but for entities not covered by HIPAA, how do you manage privacy of your medical records once they're moved to Google or Amazon or a small app developer that they're outside the constraints of HIPAA? I would envision that, again, more of this comes back to the consumer, that just like you do with your bank account, who's accessing, you control the transactions, you have visibility into that. Who better to monitor the audit log of what's going on with your records than you yourself? It's tough for an algorithm to go through looking for bad behavior, and it's even tougher for a person to go through that. So I think the future will be more in the hands of the consumer having access and control over their own medical records.
So for our viewers, Phil, you were one of the original architects of the Cyber Houston Cyber Preparedness Assessment. And you helped map it to NIST controls, 800-53 controls, as well as you operationalized it across other frameworks. So, and I think you've told me that you consistently use it and recommend it to your customers. How do you use that preparedness assessment?
Yeah, and I'll share what that looks like with our audience here in a sec. But I think there's two things, that one was, as the Cyber Task Force in Houston, there's our altruistic side that wants to help others. Just like physicians want to improve health, we're experts together in our fields. How do we share the knowledge and share the information and help others? But the other part of that, and I think, again, this relates back to the virus and the COVID-19 that we're dealing with today, is in industry, we're all connected to each other. So that that chain of connections, and that's where there's vulnerabilities. We all remember the Target hack, and that came through a vulnerability in a HVAC contractor. So it wasn't Target itself, it was that. So just as if we, and this is why I encourage, again, all our participants to use this, is I want their cyber hygiene to be tighter. Because that helps us be more secure. So the more your partner, you trust that your partners are being secure, have good cyber hygiene, the more flexible and easier it is for you as a connection in all of that. And I think, again, I see the, just as we are with COVID-19, we're making individual decisions about what we're going to do and what we're not going to do as risk in the community. But part of that is, wearing a mask, for example, is to protect others. If you understand that everyone in your community is doing their best and practicing safe COVID, you're more likely to go out, more likely to interact in safe ways. If you think nobody's taking care, then you're going to be paranoid. You're going to lock yourself in your house and you don't do anything. That's going to drive the economy down more. So I think there's a lot of parallels between what we're doing and the reasons we did that. But I want to share if I. Oh, I'm sorry, that's not the one I was sharing. No. Let me share the right one. It's going to trick me.
So are you trying to, I think you're logging into the cyberhouston.org.
I might have to I'm clicking on the right window to get it to come up, but it's bringing up this map.
Okay.
Instead, I don't know if Leslie has it, can show it. Perfect, thanks. So this is something that we put together, a group as Cyber Houston, and it was really aimed at the C-level or business owners in terms of what are the things that I need to do, should be aware of, and around cyber hygiene. So around the threats, what are the risks? So we really tried to put a tool together here that was easy to use, that didn't go into everyone. Like, we're going through this high trust at the moment, finishing off that. It has 19 domains, but within that there's like 50 or 60 items with each one, so it becomes huge. It's not really easily digestible unless you're a CISO or a cyber expert. This is aimed at the business level person at the board or at the C-suite. Is what are the things that I need to ask my organization? Are we doing this well? Are we not doing it well? It has a scoring system in there. You can download this if you are concerned that someone could see it, although it's private, it's free. You can download this as a PDF, as zeros, and fill it in on paper. It has a scoring system of fairly easy tools of, what we get. Sorry, we don't have anything on this. We're not doing it at all. We're starting to think about it. 2, we're trying to perform these activities when we can. 3, we've got it documented, but we're not really doing it, which again, in HIPAA in healthcare is a problem. If you've got it documented that you do it, you better do it. Otherwise, there's big fines. 4, feel comfortable. We're doing the best we can within our budget and resources. And 5, we really got this, so that you can come out with a score and an overall. And we've categorized that in 3 groups. We've got some work to do here, or we're looking pretty good, or great job. So a 15-minute assessment can get you close to where you are for your cyber hygiene.
So thank you, Phil. That's, you walked us through the cyber hygiene portal and the cyber preparedness assessment. I believe it has like 9 or 10 different categories, and each category has several points. So it's like a 68-point assessment, and it's a great tool that you and Andy Sawyer, Jesse Carrillo, Mel Navarez, Jason Ritchie, Mary Dickinson, Elizabeth Rogers, and a whole host of others had worked on. And I always run the risk when I start taking names, but I hope I didn't. I think Deepak Chowdhury was also part of it. But This tool has been downloaded almost 1,700 times in the last year and a half. And we have now a few consultants that have been using it regularly in their assignments to start off a conversation and to educate and inform people of the different areas that they didn't even think about as far as cyber security is, and, you know, like confidentiality of information and the background checks, etc. So, and with your doctor's offices, you've got smaller doctor's offices and clinics that may have limited IT resources and they lack the cybersecurity sophistication. So this has been a great tool for small and mid-sized businesses to go through and begin to understand how they can improve their cyber posture. So,
yeah, I hope so. I agree. You know, a lot of people put a lot of work into this with that in mind. And you're right. You know, we've got rural clinics in West Texas. You know, one physician practice, the last thing on their mind is cybersecurity. That's not what they do. They're taking care of patients. They've got 3 jobs out there because that's the way it works. So how do you help them on a super low budget, but just be aware of what the issues are and where the low hanging fruit is?
So we have on Facebook, we have a fan of yours, Hunter Perry from San Antonio, saying, "Go, Dr. Phil, he's cheering you on."
Thanks, Hunter.
And then we have Elizabeth from Houston saying hi, and she says this is a good resource.
Oh, great. Hey, Elizabeth. Thanks.
So, all right. So I think we are kind of coming down to a wrap up. And I want to thank you for sharing your expertise with us today, Phil. And I look forward to having you on again soon.
Oh yeah, no, Umesh, is there time for? I wanted to share one other healthcare story with you,
do that
if there's time. You know, this is, and again, it sort of relates back to the COVID thing, and it has an interesting twist to the story. So, if I could take you back to 1832.
Yes.
This is before, you know, bacteria were understood. You know, disease came from miasmas or foul air or bad smells at that point. But up until then, about, you know, death rate in postpartum women, you know, just after having a baby, was about 1%. Then after that, it went up to about 7.5%, 8%. And although this wasn't picked up at first, one of the changes that happened, that physicians and residents were asked to start to do autopsies on cadavers, on dead bodies, so that they could understand better what was happening. But nobody understood what about hand washing, or again about bacteria. So this one physician in Hungary, his name was Ignaz Semmelweis, and this is in the 1840s. He's an obstetrician. He's delivering babies, and he notices that the midwives, the death rate in their ward is about 1%. The death rate in the physician's ward, where they're delivering babies, is this 7%. And it was actually his friend and mentor who was doing an autopsy on a cadaver, got nicked by a scalpel blade and died of basically the same disease, septicemia. So he sort of figures this thing out, and that there's a connection between, you know, cutting up cadavers, not washing your hands, going delivering babies, and mom dies. So, you know, again, in this miasma role, he is looking at the smell of his hands. You know, they stink because he's been cutting with dead bodies. So he tests different solutions, and he finds a solution of bleach and lime juice removes the smell. So he puts this in place, starts washing his hands in bleach and lime juice, then delivers babies, and the death rate goes down. So it's like, hey, bingo, this is cool. So he makes it a practice in the ward where he's in. And indeed, it really helps. And, you know, later we find out why that is. And it was a Streptococcus bacteria that was causing this death. But the twist of the story is the poor guy didn't really publish. He didn't understand what the cause was, only the outcome. And he was kind of preachy about that everyone should start washing their hands in bleach and lime. And so nobody took any notice of him. And he died a few years later in a lunatic asylum, probably from some infection from a wound from being tied down. It was kind of a cruel end. And it wasn't until Louis Pasteur and later, that we understood about bacteria and vaccinations that this hand washing thing really became a practice. So I thought it was both an interesting story and discovery related to hand washing, and us talking about cyber and how you communicate, new ways of doing things, and make sure they go into practice rather than the an aside on that, I was just looking up before we were talking, the Heartbleed, which what came out in 2014.
Yes.
Yeah. It's Open SSL. But there's still Open SSL implementations that are vulnerable out there 6 years later. So we're just as bad in cyber as not learning the lessons. Why doesn't everybody just patch it day one, make it go away, so.
Well, you bring up a really good point, and you said 1836 or somewhere thereabouts. I didn't write that down,
Right.
but that was like almost 200 years ago. And now it has become such a big thing that says, hey, we must wash our hands. We must clean the stuff under our nails, and, there's so much more emphasis on personal hygiene at this point in time. And you're making a good parallel that says that cyber hygiene has many of the same parallels and similarities. Let's hope that it doesn't take us 200 years to identify what all those open SSL connections and those Internet of Things devices that are hanging out there with open public IP addresses.
Exactly, I know.
Doorbells and all that are now on the Internet of Things and Nest devices. So it's a very different world. But yeah, that's a great story. Thank you.
No, and I think as well, there's potential parallels and connections here. Medicine today is trying to find pan vaccines, not a vaccine that's specific to the COVID, the coronavirus, this novel coronavirus that causes COVID-19, but a vaccine that could go more at the root level of these pathogens, these virus, and eliminate whole future ones that we don't know about. In cyber, we're trying to do the same thing. We're always reactive. So a hacker creates finds some vulnerability. It beats up a bunch of organizations, and then we find a patch for it, and some of us fix it and some of us don't. So could we put these brains together that are trying to solve these problems, and how can we relate the way we work in cybersecurity or the way we work in healthcare to predict the future, to anticipate vulnerabilities and viruses and targets, both to the human body and to the computer, and nip them in the bud? And I think it also brings up the interesting business problem. If you're so good that you can do that, then where's the money in it? Who funds you to do that? Because now you solve the problem before it happens. So there's interesting dilemmas that I don't have any answers to, but I hope this audience that's listening to does. And there's a lot of good that comes out of this.
Yeah, and so we kind of we encourage them to reach out to us. Great topic, great discussion. Thank you for sharing your expertise with us today, Phil. I look forward to having you on again. And for our viewers, we will be posting this presentation to the Cyber Houston YouTube channel, as well as the cyberhouston.org website. I'm just quickly checking to make sure that there aren't there are a few comments off of Facebook and YouTube, people thanking us, giving us thumbs up. I see one angry face. I don't know what that means. Thank you for sharing and telling us, encouraging us on. So to wrap this up, Cyber Houston is a coalition of volunteer business, cybersecurity, academic, government, and civic leaders. Our goal is to continuously educate and inform business leaders on how to manage and govern cybersecurity risk. We take lessons learned from our enterprise members, distill them down into sensible, economical guidance to help small and mid-sized businesses improve their cyber posture, build resilience, become better and stronger suppliers back to the enterprise. all through the lens of helping SMBs grow their business. This guidance comes in the form of the Business Vitality Guide, guidance for the Board of Directors, the Cyber Preparedness Assessment that you saw Phil demo a little bit of, and the free Cyber Scan, which is an Active Directory cyber hygiene assessment. And all of these resources are free of charge and can be found under the Resources tab on the cyberhouston.org website. Remember, this is all done through volunteers, civic leadership, all developed, all put in, and all distributed free of charge to our community leaders and beyond. So thank you everyone for joining, and special thanks again to our sponsors, Hewlett-Packard Enterprise, Blue Lance, Reneka Digital, and the University of Houston Downtown. Thank you again, Phil, for taking time out of your busy day and sharing your expertise with us. And with that, please remember to join us on Wednesdays from 11:30 a.m. to 12:30 p.m. Central Time for our weekly Cybersecurity Mastermind series. Be safe, stay healthy, have a great day.
Thanks so much.
All right.